So Karthikeyan Shanmugam is a research scientist at Google Research India. He's been there since April 2022, and he's part of the MLO team, Machine Learning Foundations and Optimization. Previously, he was member of research staff with IBM Research AI in New York, and he was a Herman Goldstein postdoctoral fellow at IBM Research. He obtained his PhD from UT Austin, and his advisor there was Alex Timakis, where he worked on information theoretic ideas. He obtained his master's degree from University of Southern California, and prior to that, his BTech from IIT Madras. So his interest areas lie in graph algorithms, machine learning, optimization, coding theory, and information theory. And recently, he started working on causality, but still he has some of the most significant papers in this area across the world, to his name. So without further ado, I'll hand it over to him so that he can start his.
Sure. Thanks, Rahul, and thanks for having me for this lecture series. So first question before I even start. So how many of you work on causal inference as a formal area or have applied the methods to some applications in your research work? Is there anybody like that over here? Okay, so there are a few people. And then have you been familiar with causal inference as an area of work, like in statistics, for example? Okay, so there are a few people who know, and the rest of the audience didn't raise their hands. So I'm assuming that a lot of people are pretty new. So the first lecture won't be any math heavy or anything of that sort. In fact, a good way to think about causal inference is one of those subjects where you need to, download a lot of common sense and offload a lot of your mathematical sense a little bit outside, so that you can make sensible estimators and stuff like that. So I'll start on that note actually. But before I go into the things that I want to show you on the slides, so first 30-40 minutes will be on the slides. Please feel free to stop me at any point if there's any confusion. You can have as much discussion as you want. I'm going to only briefly introduce potential outcomes today, not prove anything very weighty today, right? Just to give you an introduction of how things go. And after that, I'm available around for questions too. So you can ask me later, but you can stop me anytime and ask me questions. Okay. So before we start, I just want to give you an overview of causal inference as a topic today. Okay. So basically, it started formally, I would say, in statistics, maybe econ, right? They started looking at a lot of empirical problems. So basically, usually you're given a table. Somebody had acted, somebody carried out a policy, maybe in economics or in healthcare, something, right? And you observe some data. And the questions are always about which policy should I choose in a target population. It's a very targeted, very specific question around which the field arose, actually. And a lot of people have worked on it, and I'm most likely making a mistake by not acknowledging all the great people who work, but it starts with actually Fisher and Neyman themselves. And along with the frequentist statistics, this was one of the cornerstone causal inference, at least potential outcomes framework, which I'm going to introduce first, is one of the cornerstone cornerstone things, application of frequentist statistics. You can think of it that way, right? In fact, so much so that it is actually called the Rubin Neyman potential outcomes framework. It started maybe in the mid-70s. I mean, the earliest papers go to the 70s all the way till, it's going on still, but this saga sort of ended maybe, let's say, early 2000s or something, right? It's like it's okay. What was the question that you made? The driving question. Which policy or which decision should I make so that I get a maximum reward or an effect, given that somebody had already given me some data about some experiment I have performed, right? So that is like the burning question. So for example, in healthcare, there are lots of cases where you have a drug, but you can't actually implement a randomized controlled trial very safely because it would be impinging on ethical issues. So I'll give you a very simple example. It's actually started the field sort of. It's a very nice story, but I have to say it in a politically correct way so that I don't offend anybody dead or alive. The big tobacco in the US, they were sued by a lot of agencies of all kinds, saying that the tobacco that you sell actually causes cancer. Okay, so it went on to the Supreme Court of the United States, and there was like a very big drama. And the tobacco companies hired Ronald Fisher. Okay, so Fisher came and he simply said, very simple. He gave a testimony in the court, right? And he actually came up with a very simple argument to almost withstand any scrutiny that you could possibly have from the other side. So if you are claiming that smoking causes cancer, he would actually give you this very simple example. He said there is an imaginary gene, okay, in human body that causes you to smoke more. Like if you possess this gene, if it's expressed more, you have a higher propensity to smoke. Okay, and then he said the same gene correlated with many other factors also causes all the problematic things you associate with smoking. Let's say lung cancer. That's it. He said that there is no causal effect between smoking and cancer. So this is my argument. I just don't know what this gene is. Nobody has figured it out. Is there anything mathematically that you can tell me that would basically throw away this hypothesis? That was exactly his testimony. Okay, it was a very powerful challenge. The problem here is the following. So if someone were to ask you this question with something else, for example, let's say I want to ask you with some drug which is not so doesn't have any great side effects, let's say, and if I want to ask you if it solves common cold or not, right? At least what I could do is I could assemble a bunch of people like you. Let's say I divide right in the middle of this hall, and the left-hand side I just ask you not to take the drug, and you guys ask you to take the drug, and I only assemble people who have common cold, let's say, and then I try to look at the effect, right? At least it would constitute a randomized control trial. The problem here, though, is that if I want to do that straight up front here, I have to force half the people to smoke. Okay? And I have to force half the people not to smoke. Right? So he knew that that's not going to happen because the main argument is that it is so bad for health. So if that's the effect you're trying to determine, you're always in this problem. So that's kind of problems are numerous in healthcare. Okay. I don't want to again name very specific drugs, but the FDA in the US has a long history of approving drugs which were later found out to be actually very bad for your health. Right? And sometimes observational studies are conducted to basically show that this drug is actually very effective because you can't actually do a randomized control trial. Maybe a drug for stabilizing pregnant women if they develop some specific complication, let's say. It's not very easy to do randomized control trials in those situations, right? But doctors who prescribe these drugs sort of have a commonsensical feeling that something is wrong with me prescribing this drug to these patients, and then a lot of people gather together and they actually recommend a randomized control trial because they say that we already hurt so many people, so it's not going to make too much of a difference if you hurt like 10 more people. So only if it comes to that, for example, you would actually approve a drug like this. Already mistakes have been made and enough has been made, and then you would probably want to do a randomized control trial, right? So the primal problem in economics and in healthcare, at least in the 70s, 80s, even today, 2000s, is basically that you have been given a data where there are a bunch of decisions that people make based on some circumstances. Some of them you know, some of them you don't know, and then you get some outcomes, and you just look at the table. You want to do some magical machine learning, right? We are in the age of AGI and all that, so you must be able to answer hopefully that which option is better. Okay, so it arose in that particular community, but we will come to Perlian approaches, and there the history goes back even before. So epidemiologists in parallel have also been looking at these problems all the time. But in the statistics and econ community, there were a lot of methods in the 80s, in the 90s, and even late 2000s, for example, And some of them have also led to the Nobel Prize in Economics. It was given recently to Rubin Rosenbaum, right, and Joshua Angrist. And that was for one of the methods that they developed, which could actually try to estimate effects even if there is confounding in the data, unobserved confounding. Right, so it's a very important field, at least in economics and statistics, and it goes across. Okay.
So just to sort of be a bit pedantic, the reason for this is like you're looking at the joint distribution of smoking and cancer.
Yes.
You cannot.
Yeah. So what you can have is that probability of lung cancer given smoking. At best, you can estimate this. If it's high or low, it will still satisfy any conditional probability times whatever, the joint probability distribution. I can always have a common randomness which can try to explain. Right. So the question really is, how do you rule out something like this? Okay. We will come later to this problem, perhaps, and I'll try to tell you how people have tried to solve the problem. In 1860s or in 1900s, okay, I don't really exactly know the years. The first causal inference was not done by Fisher in a testament in a Supreme Court case. It was done even before, 1 century before. And that was a very interesting question too. In Britain, people used to dump their, literally their waste sewers into the rivers. Okay, that was the common practice. And people used to get cholera. And people didn't know that this dumping of sewage in the water actually causes cholera in people. And usually you find people who have cholera only in the poor, neighborhoods. So at that time, the prevailing knowledge was that the poor people's habits are so dirty and bad, and that they get cholera, and the rich people are fine, and there is no causal association with dumping of the waste to the river. You can go and read how this cholera thing was resolved. It was a very beautiful exercise in simulating a randomized experiment when I cannot do any randomized experiment. Because if I were to do a randomized experiment, again, the same problem. Sewage and the waste in water causes cholera. What are you going to do? Are you going to split people into two things to and make them live in two rivers, and one you literally dump waste and then the others you don't, and then you finally figure out, oh, this actually was cholera? That's not also going to be possible, right? You need other methods that are sufficiently indicative of the effect that you're looking for. Okay. Some people think that when I say this, some people think it's a very subjective question and it's not an objective area of study. The only reason why something is subjective and stays subjective doesn't go to the domain of objective is because there are only certain assumptions you can make under which you can make claims. The only subjectivity arises whether which set of assumptions you can actually impose on a given one. Okay, so in causal inference, that has always been the problem. The problem is not that there is no theory, even there's very sophisticated theory to say under very general confounding conditions what all can happen, how you can actually estimate treatment effects. But the point is you have to, like in any given problem, those conditions must hold. Right? So there are a lot of open problems where there is an idealized set of conditions, right? But there may be a minimal set of conditions that actually could work in an actual target problem or an application problem. But that would actually spawn new methods of actually even eliciting the treatment effect. And those will all be open problems for us to solve. And I'll point out a few of them here and there, but in much later lectures, not now. Okay. So it is basically decision science. That's how you want to think about it, because that's a probability question. Now, there's a philosophy part to causality that goes back very, very, very far. Like what does it mean for anything to cause anything else, for example? And there is this famous Mills criterion. I'm not going to talk about any of this because this is borderline philosophy, so I won't go into this. I'll keep myself to probability and statistics. And this is in the 1900s. He was actually an employee of the British East India Company. He came to India. And when he went back to Britain, he came up with this three interesting criteria. And you can actually take a look at them. So those are very primitive understanding of what it means to have cause and effect and so on. Right? It captures some intuition, but it's not like robust. So then the philosophers came up with a bunch of thought experiments. They're very clever. I might devote maybe some half of a lecture or something to this area of work. But the idea is to define a cause so that it falls on the right side of the thought experiment, all of them are very common sense thought experiments. So if I had to tell you, you will know the answer, but you are just searching for that one definition that would actually fall on the right side of all thought experiments. Okay, and this actually leads to a proper definition of what is called a counterfactual. And if you are in machine learning, you would have heard counterfactual reasoning thrown about in multiple areas like in explainability or fairness and stuff like that. It actually comes from trying to understand what does it even mean to cause something. So again, just want to give you a preview of the issues involved here. Suppose, I mean, God forbid, but suppose there's a fire here, right? And let's say, something happens, we all have to get out, and there's a police commissioner who comes and he wants to investigate why the fire happens. Let's say I'm the speaker and he asked me, did you notice anything? I said, okay, there was oxygen. I just said that. It's a correct answer, scientifically correct answer, but the thing is, that's not the cause you're right? But it's a necessary cause, but it is not the cause that you're actually looking for, because you're looking for what is called a sufficient cause. So there are enabling variables that are already there. I'm not interested in those. It's all common knowledge. I'm only interested in that which would actually bring about the fire on its own. Not that that's the only condition that's possible. It could be a lighter, it could be something else, it could be something else also, right? So all these other causes, even mutually exclusive, by itself could cause fire when oxygen is present. But then oxygen alone is not enough to cause fire, but it is necessary, because if I pull out oxygen, if I create vacuum, then there would be no fire, right? Now you might think, okay, then it means that you have to only worry about sufficient causes. Now let's take legal justice system, for example, and it's very closely related to issues of fairness, which again, hopefully I'll come to at some point in time. Let's say you are handing out a judgment. There is some victim who comes to you who has been harmed. There is another person whom this victim claims has harmed him, right? Or harmed him or her, actually. Now, let's say there are 4 suspects, for example. Let's say all of them are somewhat involved in the crime. Let's say. Now you want to hand out, counts of punishment, for example. Of course, you want to give jail time anywhere from 10 years all the way to 1 year or 2 years. Question is, who will you award the highest, jail count, for example? Here, the person who is actually necessary for the final harm, right, in some reasonable way, right, would actually be prioritized, because if that person wasn't there, then the time would. Maybe the person actually ordered a hit job, let's say. Then I didn't actually consider the necessary job, a necessary cause. But then one of you went and carried out the hit job between, fell down somewhere between, and we got caught. And then the question is, who's going to, get more? So I'm not trying to answer legally here. I mean, you may like one answer or the other, but here necessity is prominent. That's all I wanted to say. Okay, so depending on the case where you want to make a decision, you also want to know what type of a cause it is. Okay, there are few explainability tools today that do work under a lot of assumptions, but when applied on data, they'll actually give you a scoring of different features based on how necessary or sufficient it is for it to produce an answer in a machine learning. Okay, so what is the formalism and what do you want to compute? How can you estimate any of this? So that's another line of work that basically comes under the rubric of counterfactuals. Okay, so these are still very classical areas where causal inference was always very active, but in the last 1 decade or so, there is, okay, so the question was, how does ML interact with causality? Okay, there may be 2 reasons why you want to answer this question. One is,
sorry, question on the previous part. So you said there is necessary and sufficient causes. It seemed to me that like if there's a fire, oxygen is a necessary cause, but not that important compared to the other thing, the actual cause of the fire. And in the criminality case, it was necessary, which was more important. So it seems to be a spectrum.
correct.
And how do you define like a spectrum in that case?
Okay, so you're actually asking for the probability of necessity or sufficiency, which I was planning to define much later. But let me give you a very simple reason, how to estimate it different. How different estimators can give rise to different causal effects, right? Okay, so let's say you want to find out about this oxygen and this one more spark, right? That this is necessary, this is sufficient. So whatever estimator you have should be very high here and very low over there, okay? So there are two estimators that you get, two counterfactuals that you can think of. You take all the cases where there was a fire, right? And you remove oxygen. And you try to understand whether the probability of fire decreased or not. Okay, this is one. So you take all the cases where there was fire and there was oxygen, of course, and then you remove oxygen off, and then you try to understand whether still the fire would continue. Right? Let's not worry about how you estimate this. It's not important. The question is, the estimand is important. Now, suppose you want to understand the legal question, or let's say in healthcare also, you are interested in the sufficient cost, right? Which means the drug by itself must cure you. Otherwise, why am I selling the drug? Right? So there, what you do is you look at the dead people. Just counterfactual. It's all counterfactual, so there's nothing factual that's being considered here. You look at the dead people and look at all the people who have not taken the drug, so no drug. And then you actually give them the drug and check whether they live. If they do, then it's a sufficient cost. There is a lot of difference between the conditioning here. What is it that you want? You want actually to know what increases the probability of fire, right? So I looked at the positive case, and I looked at the cause being present, and then I removed the cause, and then I looked at whether it dips or not. In the other case, I did the opposite. I looked at what do you want? You want people to live, right? So I looked at the case where people are dead and they did not take the drug. The cause was not present. Then I put in the cause, and then I try to understand whether you will increase or not. Okay. So this is called probability of necessity. This is called probability of sufficiency. And there is a probabilistic counterfactual that you can estimate, which leads to these two numbers, and they do have very interesting relations to other probability things. Hopefully, we will get to the point, but that's how you distinguish between necessary cost and sufficient.
So necessary, you add some effect, add some cost. Sufficient.
No, necessary, you remove the cost you want to estimate about, but you condition on the fact that it's already present and it has caused the good thing you want. Okay, so conditioned on both, if I remove the cost, what happens to the good thing? The sufficiency is the opposite, where both are lacking, the cause is not present, and the bad thing has happened, and you put in the cause, and you try to understand whether the thing would increase or not. These two are very different questions. For the same outcome, a given feature will be more necessary but less sufficient. So the slider that you're asking for is a probabilistic version of that. Okay, but I don't want to dwell on this more because it's supposed to be like some 7th lecture or something. You don't know how to even state these estimates without the theory. But since you asked, I just wanted to explain this is how you distinguish between necessary and sufficient cost. So let me come back to the story between ML and causality.
Big element to it. You are, it's not just, I mean, I'm trying to be a bit pedantic here and say it's the probability of some, like when you say good event or bad event, that's a semantic.
Yeah. No, what I was saying is that let's say you have binary variable, and you're interested in the probability of necessary cost for y is equal to 1. So I meant 1 meaning good event. I just wanted to distinguish between the two.
If you're cooking fire is a good event.
Yeah. So I mean, I meant the good and the bad, not in the sense of English words, but I meant just two binary options. So if you're interested in y equals 1, let's say call it the good event, and you make that happen, and you have the cost, but then you remove the cost and you see how much it is, right? Of course, in most cases, this may not be estimable, but the interesting part, then what does causal theories tell you other than just define these quantities? What is the point? The point is that in some cases, you can obtain bounds on this, even from observational data. And I don't know enough about how the world works. Confounder has a lot of very interesting results in this thing, and there's a lot of follow-up also. The bounds are actually very interesting in the real world because statistical estimation community is all about getting the right answer. They estimate convergence rate, mean squared error going to 0 and all that, right? Here in causality, we are actually making real-life decisions. We just want to know whether it has a huge positive effect or not. So even if you give me a lower bound of that, it's very, very useful in practice. If you actually go on how people make decisions, they just want to know whether it will give you at least blah percentage of increase or not. They're not interested in knowing what exactly the reward is, right? So bounds are very useful. And these bounds have a very different nature. They are not like your bounds which will go to 0, like the confidence intervals that go to 0 as you get more samples. They are epistemic in nature. So you need to tell me some new causal information if you want them to converge, basically. So we'll get to all of that, but I don't want to digress too much.
The philosophy question, as you said, the Indian philosopher you mentioned some time back, like
Maybe I'll come to that much later. Yeah, so there is a lot of interesting thought. I mean, all over the world, of course, a very fundamental question. Without knowing what causes what, I mean, even babies won't know how to walk, right? I mean, they implicitly start learning all of these. Okay, now let's come back to ML and causality. So there's a lot of work in this decade trying to figure out how causal inference can help ML and ML can help causal inference. Okay, I could cite many things, but let me cite one simple thing that could sort of strike a chord with you, just like this oxygen example, right? This is something I've encountered in my own work. So let me actually give this example in this particular way. So suppose you are in the radiology department, right? You have different kinds of tumors, okay? So let's call them Y, and they belong to big set Y, okay? Then you go and do an MRI, you get X, just like this big, image of wherever the tumor is, or some CT scan, I don't know, right? Now let's say that in the real world, right, Y was actually tested by a biopsy. Okay. They actually did a surgery, they isolated the tumor, they did some biopsy, they labeled. Then they passed you through the MRI scan, and then they got X. Okay. Now you could also obtain this from a different way. I could give you the MRI scan, ask a very talented radiologist to look at the MRI scan, ask them to label that one. That's also a point. It turns out that depending on how it was generated, sometimes it is better to actually estimate in the causal direction. So if I want to give this as a classification problem, what would anybody do? They would actually try to fit a classifier probability of Y given X, right? That's what you would do. Now I can very easily torpedo your classifier. It's very simple. I go to one hospital, let's say the lung cancer people are 80%, like some other tumor, I mean, whatever, you can have a brain tumor, let's say 20%. I just literally flip the ratio, 80% for brain tumor, lung cancer is 20%, right? Let's assume that probability of X given Y remains the same, because this says that if you have this kind of a condition, this is the distribution of MRI images you will get. So that is how the nature works. So you can't go and change nature, so there's nothing changed there. All I have changed is that when I went to a different hospital, the ratio of people coming is different. Now by Bayes' rule, if P of X given Y does not change, but P of Y changes, P of Y given X has to change. So you are chasing a rabbit which is running all around. So you will be trying to fit a classifier. In fact, if it's very well calibrated, it will be wrong on the new hospital. Right? So I've created a very simple situation where if you just did classification, it's not going to generalize. There's really nothing complicated happening. I mean, it's the same MRI, it's the same human anatomy, everything is the same, nothing has changed. It's just that the way the label was generated was first done using some other mechanism that actually caused the MRI, right? And therefore, X given Y is sort of the same, but P of Y actually changed in the new hospital. So P of Y given X cannot be the same. So there's a very beautiful paper by, so I don't have all the people in my mind, but I think it's Sholkov, and Kunjang and others. It's called Causal and Anti-Causal Learning. Okay, you can go and take a look at the paper. So this basically said something very interesting about how you should fit classifiers if you want robustness. Right? Nothing is, I mean, it's not necessarily a priori a causal problem. It's supposed to be a Bayesian inference, I mean, Bayesian decision theory problem. That's how people are introduced about Bayes optimal classifiers and so on. The point is the Bayes optimal classifier is not robust, right? But the mechanism is still the same. Okay. Yes.
If you are evaluating the question, the classifier that you see is biased.
Yes, you could call it label imbalance. I'm just giving you a causal story as well as how to fix the problem using causality. The point is you learn P of X given Y somehow. Of course, X is high dimensional, so in practice, this is not the easy problem in finite samples. But you're right, you could call it label imbalance problem. But nothing has changed in the real world. I mean, there's no shift of any kind. I mean, it's not the mechanism of how you do MRI or anything has changed, right? It's so simply that the Y was actually generated first and then X came later, but you are interested in predicting the other direction, right? That's the only cause of robustness. Yeah.
I mean, the takeaway is that if you believe that this is the causal thing, it's a more robust direction to do the correct direction.
Correct. I don't know if I'll again get to this. There's a lot of very interesting connection to what is called Kolmogorov complexity and algorithmic Markov condition and all that. We make it very precise in a particular sense where under some nice postulate, which implies second law of thermodynamics, you can show that this causal to the effect direction is actually the low entropy direction in some sense. But if I say too much, I would be making very vague statements without actually justifying. But that's very related to the question you're asking. Yeah.
So a priori, you don't know whether X causes Y or Y causes X, except for a belief.
Correct.
So what you do is you go in. What one might want to do is to go and test out first whether X causes Y, Y causes X.
That's a more difficult problem because then you need some randomized experiment, some idea. Here, all I'm simply saying is that just go to the doctor and just ask how the label came about, which is some metadata that you would know. But if you knew that the label was generated first followed by X, which in a lot of cases you would know if you're trying to apply, then what this says is that the other direction is correct. That's all it's. So you do an autoencoder for label Y, which is lung cancer, do an autoencoder for the brain tumor. And whenever a new sample comes, you pass it through both the autoencoders, look at the reconstruction loss. If one is higher and the other is lower, just classify them. You can always make a classifier out of this, like by doing class conditional distribution. But people don't prefer that because not the easiest thing to learn autoencoders because on very high dimensions. But because of robustness reasons, sometimes it might be a good thing.
Yeah. So the security against this torpedo that you suggested is to learn on distributions that are going to be the same at test time.
Conditional distributions that are going to be the same. Yes, correct. Conditional distribution. So here P of X given Y is. So this leads to what is called the very famous invariance condition. You can think of this as a signature of causality. If there is one signature of causality anywhere, it is this invariance, at least statistically speaking. I'm not counterfactually speaking, but statistically speaking. And this is a very simplest demonstration of invariance. But of course, it has a more grander perspective, and it actually leads to other types of methods like invariant risk minimization. If you have heard about it, Leon Boto's recent work, that all actually sort of like start from this particular right. So that's the overview. I'm already like 40 minutes. I thought we'd be done in like 10 minutes or 15 minutes. But let's start with.
What is the invariance here?
Okay, so what it refers to is that if you measured variables from a real world causal mechanism, unless you went and changed that mechanism, that is going to stay.
Okay.
Any variation you see in the data, any other distribution shift has to come from something else, but not due to this condition. So you start identifying conditionals that are invariant. And if they stay invariant over multiple distributions, then they are probably more causal than any other alternative. And we can make this very precise in the Perlian framework. I'll come to that. Yes.
During inference time, how do we use class conditional densities to make a decision?
In this particular case, the label is just a discrete one. So you assemble all the MRI scans corresponding to lung cancer, do an autoencoder. Then do an autoencoder on like this brain tumor. You have two autoencoders. It's a complicated setup, but if you want robustness, you could do this. That's all I'm trying to say. If a new label image comes, pass it through both the autoencoders, look at the reconstruction loss. Whichever is higher or lower, you can just do. But if Y is also high dimensional, yeah, it's a bigger problem. It's not very easy to solve, and there's curse of dimensionality.
It's like sort of a bypass, right? You're effectively you're saying I'll have one classifier for lung cancer, one for brain tumor.
No, it's of a different nature. The interesting part is that in classification, if I add 10 more labels, your classifier will change, correct?
Right.
But autoencoders won't. I have a very interesting example here. I hope I can make jokes. So let's say, I'm a South Indian, I like sambar, right? There are many stews in the world. I have not sampled any of them, right? But I'm a good, sambar classifier. You give me some stew, I'll know whether it is a good sambar or not, but I don't know what it is. Bayesians would want you to fit a whole prior on all the stews that are available and then take data and then figure out what's my posterior on this particular sample. That's not how humans usually reason. And this is one example of it. That's a good question. So you can have like many other cancers that you've not seen. Now, if I put that in the data, of course, you are going to train a classifier that looks very different because the decision boundary will change. But here, I don't have to because I can still keep my organ. But that's my sambar, so I know that. I don't know any other stew in the world, but that's fine. Right? It's a very conservative approach. Okay, now let's get to the slides. It is very related to the story I've been saying so far. Okay. So how many of you think they're very strong in logic? So all of you are very strong in logical reasoning. Of course, there are complexity theorists here, so I shouldn't be even asking this question. So there's this principle called the sure thing principle. Okay, there's a very nice technical report in 2016 by Julia Pearl. I would encourage you to read it. It's a very mild read to say why causal reasoning is of a very different nature. Hopefully, by the end of the 9 slides, I'll convince you at least a little bit that there is more to causal inference. Okay, so here is the sure thing principle. It was first proposed by, I think it was probably proposed even before, but there's a philosopher named J.T. Savage. He actually proposed this principle. He wanted to crystallize decision theory into one principle from which you can make all sorts of decisions in any situation, right? It's like this purest way of trying to crystallize all that into one principle. And this is called sure thing principle. If you read the sure thing principle, it will look like a tautology. So suppose F and G are two acts meaning real life actions that you are actually doing in the real world. If a person prefers F to G, either knowing that the event B obtained or knowing that the event not be obtained, it says that F is strictly better than G, whether B happened or not B happened. Let's say you are very confident about this due to some estimation or whatever knowledge. You possess this knowledge and this is correct. Then the person should prefer F to G even if you know nothing about B. Is that reasonable or no? Yes.
What exactly is B?
B is some other variable you observe. An example, actually I have an example. But if I go to the example, then you'll get very cautious. So that's why I want to know if there's any other reaction.
You like sambar over rasam irrespective of whether it rained or not.
Correct. Perfect. Yes. But you guys agree with this principle, right? Okay. Fine. So I'm just translating it. I'm just putting probabilities on the statement. So if the word knowing, because English sentences are always the ambiguous ones, right? So if you translate knowing as conditioning, that's one choice. You can make other choices too. But if you translate knowing as conditioning, then all you're saying is that y under f, like when you act using f, you get a y. I call it y of f. It being 1 is always greater than whether you do g, both under not b and b. So the question is, do you need to know about B to decide between F and G? I know this fact, so I'm just asking whether you need to know like B before deciding F and G. So obviously in our first causality lecture, I'm asking this question, which means it's not the full answer. So let me go. It's very interesting if you start giving examples to this, right? Then you start seeing that there is something wrong from a common sense point of view. So this is the example. So you go to a doctor, let's say you have a kidney stone problem. And there's an invasive treatment, non-invasive treatment. Okay, somebody says I have this fancy laser surgery, I'll remove the kidney stone. There's another option, which is to actually do the surgery, and it leads to whatever complications. And you want to know which one you want to prefer. Okay, so you go to the doctor, and let's say that in this treatment for whatever, this is a made-up scenario. Right? Let's say there's some risk of heart failure, right? When you give the treatment. So the doctor is telling you the same as sure thing principle. Whether you prefer In non-invasive is better than treatment. Would you go for the treatment? There should be one question you should be definitely asked. Something is very weird. The guy is saying whether you will get heart failure or not, the invasive treatment is better in removing your kidney stone than that non-invasive treatment. That's really the statement you are. That's the example. It's just an example. I'm just initializing this. The question is, would you trust this doctor? Right? Yeah. So this is the question. Let's just change it a little bit. Right? Let's say there's no side effect. Right? There is a precondition you come up with. And the precondition is whether the kidney stone is large or small to begin with. And that's a pre-treatment weighting. You came with this problem, and there are two choices, and you have the outcome. Again, initialize your sure thing statement. The non-invasive treatment removes kidney stone effectively over conventional invasive treatments, whether the kidney stone size is big or small. If somebody says this looks like an assurance. That looks like, a bit of sophistry, right? So in both cases, I've applied the sure thing principle. It's very clear from common sense that the first one, you would not take it. And I will tell you what you need to know before you sign up for the first doctor. The second one is all right. Doesn't seem very bad, right? So this is the modification. It was actually proposed by many other people before Pearl in 2016, but here's a nice article just sort of outlining everything. And the first person to sort of observe that there's some issue with sure thing principle is Jeffries. There was a mathematician, I think another philosopher actually. So what you need to understand is that if the risk of heart failure is the same for both treatments or not, that being the same, you are willing to actually go for something better. Because if the risk of heart failure for the non-invasive treatment is super high, then it doesn't matter, right? You will probably die out of that. So why would you prefer that particular treatment, right? So if you knew that the event that you cared about had the same distribution under both actions, okay, please ignore this do notation. I will come to that in a later lecture. This is just to introduce the thing. So you can just ignore that equation. You can just read the English line, right? So B is any event that is equally probable under F and under G, then the sure thing principle applies. Okay, so in the precondition, pre-treatment case, it's always true. Why is that? When I intervene on treatment, you don't change the pre-existing condition. It's what it is. Whatever distribution it is what it is. Right? So the distribution of the pre-existing condition does not change because you intervene. So that is satisfied here for sure. Ipso facto. So this is fine. But in the other case, you have to worry about it. You have to ask the person. I mean, okay, you're saying something, but is both the treatments have the same heart rate failure or not? You tell me that before I make the decision, right? So this is the sure thing principle. I would like to say that this is sort of contradicts the usual Bayesian decision theory, right? Because they're trying to crystallize from knowledge when can you decide, and this is a very good principle. But then causally it doesn't make sense. And the only thing I did was just change the B variable from side effect to pre-treatment. Now, there's a more interesting part. Yeah, so I just wanted to argue here that if it was a kidney stone, which is a pre-existing condition, under treatment, that distribution will not change. Therefore, this is automatically true. And therefore, you can trust the doctor. In this case, it need not be equal to B unless that person really, really convinces you that the heart rate failures are similar. You would not want to go for the non-invasive treatment. Yes.
So what you're saying is sure thing principle is not true.
No, that's being known. It's just that the objection is from causality. Right? And the more important, which relates to your question, is that let's say T is binary, Y is binary, B is also binary, just for simplicity. Right? I can give you a joint distribution. It is completely identical in both the cases. In one case, you should make your decision without worrying about anything. In the other case, you have to inquire about an extra fact before you make the decision. Right? There's nothing in the data that tells you these two. It's very similar to this question that Professor Berman asked, which is, if I just give you a joint distribution of smoking and lung cancer, what can you do? Here at least there's a confounder. Here there's really nothing. I mean, everything you observe, there's nothing hidden, everything is transparent. But just the ordering matters. Okay. So I would say this is like the first. Yeah.
Like the point is though that you're deciding on the probability of B. Like if you go back to the first sure thing, the classical statement. Or yeah, this. So here it's not that
under all, under B and not B, every single case, this is better than that. Logic would tell you,
Right.
to pick one. But I'm giving you an example in the real world where you certainly would not pick that.
But can I derive this from this like conditional probability? So
No, you cannot. So the issue is that from conditional probability, so that's precisely this issue. The issue here is that for the same, you're actually asking for the average statement effect, which is what I'm going to discuss next.
Yes.
But essentially, you have two different causal graphs for the same joint distribution. So anything you operate on the joint distribution is not going to give you a non-unique answer. You need some external facts.
Okay, so just to be like a bit precise, what you're saying that unless I know the connection between these random variables, given those two inequalities, I cannot say whether the probability of
Correct.
the unconditional thing, like probability of y given f is greater than probability of y.
Yeah, in fact, you don't need the graph, you just need to ensure that condition. In this case,
Okay.
that could be done even without knowing too much about the graph, right? If you have only pre-treatment variables, it's automatically true. I don't need to know how they are connected and what's the strength, nothing. It's just immediate. But in the post-treatment, you need to worry a little bit about such interesting things, right? So
Is there a numeric example just to?
yes, I'm going to do a very formal treatment of what conditions exactly are required minimally to do all of this. So I'm going to get there. Okay, now there is the thing called Simpson's paradox. So the example that I gave you before, the sure thing principle and the causal sure thing principle, is actually one special case of this paradox. The paradox is very simple. Let's say there's a real life data where your data looks like this. Okay. So we all do regression. So you do regression, you get a positive slope. And that essentially means you do more exercise, your cholesterol level will increase, right? So that's clearly not true. So what you do is you slice by the third dimension, age. And now you start getting negative slopes, right? So the effect changes depending on what I control. In the example that I gave you, you should control for this. Should condition on this. For the estimate I'm going to talk about, you should not worry about this. It might seem contradictory to the sure thing principle, but what I'm trying to say is if you write an effect estimator, there just conditional y given t is enough. Here, y given t comma b, you need to take the difference and you need to average over p of b. So the estimator for the same effect, given the same distribution, are different because the causal thing is different. But Simpson's paradox is a bit deeper. Suppose I introduce gender into this. There's a fourth axis. Who knows? Maybe you get back the positive line, right? You can construct examples where you take n features, you take the first one, you control, you get positive. You do 2 of them, you get negative. 3 of them, positive. 4 of them, negative. 5 of them, positive. You can keep going up. You can construct distributions and causal, data generating processes like that. So obvious question and the fundamental question is, if I give you a bunch of features and treatment and effect, what are you going to control? Right? And any theory has to give you some assumptions and conditions under which you might be able to make a precise answer to this question. Okay, yes?
Is there a proof that you can go this infinitely, this paradigm?
Yes, there is I don't know about infinitely, but if you have n features, you can show that in some particular order, if you keep taking more and more, the sign will keep flipping. There's an example in, I think, Pearl's book. You can actually take a look at it.
It is a constructive.
It's a constructive. So what actually happens in healthcare is the following. So a bunch of doctors sit around and they say, okay, these are the factors we will control for. Okay, like this, like the precondition. For 10 years, that is the usual thing to do because they think nothing else has happened. Then they go and try the treatment, something happens, some mishap and all that, and such cases keep increasing. And then you start doubting your own observational study. Then you go to a randomized control trial, you know that you missed a confound, right? But sometimes what happens is you control for more and you cause this problem, actually. So sometimes you need to dispose of certain features and only control for a smaller set of them so that you get the correct effect. But the question is, you need some sort of a formal treatment to know how would you pick that, on what conditions will you pick that.
Variables have to be independent. It could be that as the age increases, people exercise less.
True, but yeah, I think if you have independent variables and all of them cost outcome, I guess there might be a trivial solution, that is to include everything. But the usual thing here, what will happen is there will be correlations even among the features you add, and they can create very complicated confounding effects. So an example is, instead of me talking, I would actually give you an example. So the example is,
You said that this is sure thing is a special case of this. Why you say that? Because this is a single variable.
Okay, I'll work it out on the board now. So I have to unfortunately take this slide off because it's my last slide, and I'm going to write on the board. Is that okay? Or okay.
So turn the
Yeah, you can probably turn this off. How do I turn this?
the white remote and
I think you have to stop sharing.
yeah, that's the one. Press it twice.
Okay, maybe since Professor Berman asked, I would first work through that example that I gave you to find out what exactly the estimator is, and then we'll go to the more formal treatment. Yes, you have.
So in the first example, the logical statement was to take y irrespective, like the first sure thing principle. But that is because you're saying that I want the like p of y equal to 1 irrespective of conditioning is greater than in the first case, right? But in the heart attack case, we don't really want that, right? You want p of y equal to 1 and h equal to 0.
Okay. That's what we are going to. That's what I'm going. Precisely. There's another factor that p of b given t that it multiplies, and in one case you don't have to consider that. It's only p of b in both cases. In the other cases, the conditional distribution. Correct. Why is that? It's very simple. Here in this case, okay, so let's first take, I don't know if it was, I think that was the example 1, right? Which was you have treatment and you have some side effect, let's call it S, and then you have outcome Y, right? Now, all I'm saying, I mean, here there's nothing complicated when you intervene, right? Because everything is downstream of 1. It's intuitive. So you just have intuition for now. So if I want to know treatment equals 1 versus 0, what would Y be, right? So we expect, so Y would actually be the probability of Y is equal to 1 given S comma T is equal to 1 times probability of S given T. 1 minus the probability of y is equal to 1 given S T is equal to 0, probability of S given T is equal to 1, right? Because I know that this conditional does not change, this conditional does not change, therefore this is correct, right? Just intuitive, I'll actually formally derive all of it. Okay, now here the problem is, I assured you that this was greater than this for all this. I did not tell you anything about this guy. This is literally, I'm asking, what's heart rate failure? Right? So heart failure rate here for T equals 1 and T equals 0, right? I didn't know that. So if you told me that the non-invasive treatment causes 95% heart failure, then you should be running away from the hospital, at least from the non-invasive treatment, right? Now, let's take the other example. You have a precondition, so let's call it.
That was the statement of this the snake oil doctor. If I do the treatment and you don't get heart attack, the success rate is better than if I don't.
No, whether you get heart attack. kidney stone. Do the job. Then you get a heart rate failure because you came to me for my kidney problem, right? That's what it was. But you will get heart attack and die or not, that I'm not very sure. But irrespective of whether you will die of heart rate failure, this problem will be solved. That's exactly what it is. Right? Like the non-invasive treatment is. That's exactly what it is. Here, the estimator is here something happens. So when you force a treatment, whatever the usual policy was that depended on B does not exist anymore. You are forcing somebody to take one treatment over the other, right? So if I said this is equal to T and T is equal to 1, what would be the treatment effect estimate? There is no condition. Because in this graph, this link is not there, right? So you actually have the marginal distribution. Here it's fine. For every S, point-wise you are better, sure thing principle holds, you are better. Okay. In fact, this is a very general statement. As long as you have pre-treatment variables, sure thing principle holds. Okay. So we will start from that very nice setting, and then we'll go forward to more complicated. Okay. So now we'll get into some formalism. So I'm going to state like a bunch of 5 assumptions. It might look pretty exhaustive, but only a few of them are more meaningful. The other are mostly regularity conditions. So let's start with potential outcomes.
This is for a framework.
Yes. Systematically figure out what are the conditions or minimal set of conditions under which you can estimate the average treatment effect, what issues arise, what are the estimators and stuff like that. Then we'll go to the Perlian one where you care about more complicated versions of this problem. Right. So let's say that the pre-treatment variable is very important to know that it's pre-treatment in whatever I'm going to say for the next 2-3 lectures. After that, we will consider general like covariates.
Just to be again somewhat pedantic, we say pre-treatment. What you mean is that there is a treatment variable, i.e., a decision variable, control variable, and then there are other random variables which are independent of, like in a probabilistic.
No, not independent. They happened before. Meaning, if you do an intervention, it won't affect the treatment. So it won't affect these variables.
So, for the conditional, so probability of any of these variables conditioned on the treatment.
Not conditioned, intervened on the treatment.
Intervened on the treatment
is the same. Right? That's exactly the sure thing. P of B given. So P of B given. I haven't introduced this operator, but I'm already like showing you how essential it is to even reason about it. Okay, so that when I introduce in the third lecture, you won't be super surprised about why these things happen. So let's say at F. Okay. We don't know what this means, but let's worry about that later.
Just to be sort of clear, this is like, even in terms of the basic construct, this is going beyond your standard.
Already, I'm asking you to assume the model of intervention.
Okay. This is even this like term as such.
Correct.
Is not in a standard.
Correct.
Like,
that's one of the arguments why Pearl says that you should introduce everything using do calculus, which I am not abiding by, just to make you feel how essential the concept is before actually introducing it, and meanwhile also covering a little bit of potential outcomes because very useful in practice. Any other question? There was a question. No.
I can say pre-treatment variable. There's no arrow from these from treatment to these variables.
Yeah.
Or pathway.
Yeah. We'll come up with more formal. This is actually a better definition, provided you know what act equals F is. We will define that. Yeah.
But this is a separate distribution altogether.
Yes.
The point
in fact, we will start creating imaginary variables soon.
Okay.
In causality, always worry about things that you don't see. It's very, very important. Right? Okay. We will. So let me define all the things and then. Yeah.
But all of this may not be explicit yet. Some of these variables can have other like parent node. But
correct. So I will make I'll make a distinction. So this is pre-treatment variable. Okay, pre-treatment observed variables. I'll call it X and belong to some script X. Okay. Then there are pre-treatment unobserved, but I call it exogenous variables. I call it U. Okay, there's a philosophical thing of what U actually means. I can go all the way to Bell's inequality and quantum physics and stop there, but I will not do that. So let me simply put, just imagine your physics intuitions predate quantum mechanics, just for the sake of the whole lecture series. I'm not going to make any quantum statements at all. In classical physics view, randomness comes because you don't know something, not because there is some inherent randomness in nature. Okay, like think of this PV equals whatever nRT, the gas equation, right? You can't observe the position, the velocity of every gas particle in my box, right? All those things in some general position, because of all sorts of central limit theorems, give rise to some effective behavior, which is the only thing I can actually measure. Okay, so you always say in frequentist way of looking at causality, this is actually also Rubin Rosenbaum framework. It's simply saying, think of always a healthcare example. You come within some bunch of medical record, you have a bunch of features that people have noted down, and I only see you, right? Literally, you is all of you, right? All the genes, all the things, everything, every factor that you have not observed, which may or may not be relevant to the problem, doesn't matter. When you come to me, that's you. Okay, it's in some very complicated dimension. Don't have to worry about it. Yes.
Are exogenous variables those variables that don't have parents, or those variables you do not observe?
Those variables you don't observe for this particular thing. That's all there is. Not having parents is a very specific model you impose, but in this case, it's very general. Just you don't observe any of this, and you observe some of this. Right? All that I have not observed about you is this. Similar to the sambar thing, like all other stews, but not sambar is in you. I don't know how big you is, and I don't care about it. Right? Now you have treatment, which is an assignment that is made by someone or some function of both x comma u. Okay. Sometimes this is called unit. It's to say that it doesn't. You don't have to expressly define any support or any space in which this resides in order to tell that it's exogenous. So people call it just unit u. Yeah.
So understand this concept of exogenous.
Yeah.
In the context of sambar, if I didn't observe the temperature, would that be an exogenous variable?
Yeah, that will also be.
But I didn't understand why do you say other stews are like, I have never seen other stews, but those are also exogenous variables.
No. So okay, so I must have sorry, that's in the same support. You are right. So whatever factors I did not observe, I call it exogenous. Good catch. Yes, correct. You are right. Example was wrong.
But these are, just to be basic, these are random variables. This X is a collection of random variables. Q is a collection of random variables.
So
That's it.
if you are very comfortable, think of a distribution PU of it. The reason I'm not committing to this is simply because U can exist in a very complicated space,
Sure.
not just RD or something else, because it just involves almost everything that we don't see. But for frequentist statistics, if you work only with averages, it still makes sense to just index people, units, and just work with that, and that's still fine. Okay, but if you are, but for statistics, yes, you need a distribution on the exogenous space. You assume that they are arising from an exogenous. Right? Without loss of generality, you can consider U to be, I mean, in some notation, I will set U to be some U tilde to be x comma U and use it. It's okay. It's just saying that the copy of what you observe is already there and unobserved. So it is some identity function that exists. Okay, it's not a big deal. All I'm saying is that there's a copy of what you observe in unobserved variables. That's all. It's just for convenience. Okay. Now the outcome, the most important thing. This is also another deterministic function of x comma u.
Okay, treatment is a deterministic function.
Treatment is also a deterministic function, but it will look random because you don't observe. Okay. Now the first condition is that, okay, this already satisfies what is called the Sutwa assumption. Trying to figure out the direction. I think I'll erase this part.
It is oversimplistic, but it like randomized analysis. You sort of say that like all the randomness has been, all the coin tosses has been made and it's written on a tape. So that is it.
Exactly. In classical physics, there is no randomness. God has decided everything.
Yeah.
The only question is whether you know it or you don't know it. In the quantum world, different story. And that actually Bell's inequality really strikes at the heart of causality because it. Okay, I don't want to go into Bell's inequality today. That's for a later thing. Yeah.
Treatment should only be a function of observing. Treatment, like whatever the doctor is about to, he may have his own criteria for treatment.
But I could look at you not. I don't know why. No, it can be, but I'm
The
giving him.
doctor is not going, he is not able to see you. So how can he have a function?
No, but he may not. So, okay, the table is what you get, right? Which is X, T, and Y. You are a data analyst. This is a hospital record. The doctor treated you in one way, and you had some complication. Let's call it like one here again. But the person might have chosen the treatment one because maybe you had a different insurance. I don't know. All I get is the table. Yeah, but yes.
Yeah, so I'm saying that all randomness of nature can also be included in U. So this T of X comma U, though it is a deterministic function, captures all the randomness that exists in the.
Yeah, it may not depend on all.
It may or may not. I'm just saying like all this quantum randomness also is captured by.
That's what. Let's not get into quantum randomness. It creates complications. So let's not go into that. Let's just say all the randomness in the world is just simply due to a population of unobserved things. That's all I'm trying to say. Yeah. Okay, so you will observe a table like this. You came with some precondition. I treated you. You got some outcome, let's say, and a bunch of zeros and ones. Right? This is your table. Okay. But the most important quantity is what is called the potential outcome. And currently, I am defining potential outcome only with respect to pre-treatment variables. So in the Pearlian sense, people don't consider it to be the most general counterfactual. It's a bit of a tussle between two groups. One claims that it's the most general thing. The other one says there's something more complicated. But we will come to that issues later. But I am going to define potential outcome only with respect to pre-treatment variables and exogenous variables. Nothing else, right? And potential outcome is the following. There are two more columns that correspond to a hypothetical scenario, which is you treated me using treatment one. Okay, so I will call it Y1, Y0. Okay, if the same person, so this is unit U. Right, this is some individual, like little physical person, so all the exogenous random variables. This person came. I treated this person with treatment one. So this will also be 0 here. But had I treated that person, the same person, literally the same person, with a different treatment, the control, not given the drug, then there would have been some number. I don't know what it is, but it is some number. And I call that Y0. Okay. This is called the potential outcome. So you're sort of dividing the world into two. Whatever this function and whatever this function is, you are applying it. Like this is a generative mode. So you're applying it and you're actually creating Y1 and Y0. Okay, but you get to observe only one of them. So here it is 0. So you end up observing this guy. So suppose if it was so this is 1 also. So you observe this guy again. So if it is 0, you observe this. If you observe this 1, you observe this. Okay. So a lot of people say that causal inference is a missing variable problem. At least the way I've stated it is a missing variable problem. But things are not missing at random. If things are missing at random, then T is independent of both X and T. It's a randomized control trial.
Table 1 for I didn't get through. What? X is 1, 0, and then what are the two entries after that?
You mean this one or this one?
Yeah, X 1, 0, and then what?
No, I didn't write it. Okay. if you
X
want.
actually doesn't matter, right? Like it doesn't have to be even binary.
Tell me anything, I'm just writing it. I mean, the numbers don't make any sense. All I'm pointing out is that depending on the treatment, I choose one of the columns, I put the number here. But if you want to estimate the treatment effect, I need to complete all the other. Right? Yes.
So in the first row, you got both 0 and 1, but in actual tables, you will never observe both of them.
Correct. So in fact, I should put crosses more prominently. Okay. Now there are multiple models. Depending on T, multiple models arise. But let me just start with the simplest one. Completely at random, missing completely at random. It's called MCAR.
This is different from having like a arrow or like a probabilistic connection between T and Y.
There is a probabilistic connection between T and Y because U is missing, and when you marginalize over mu, I get a joint distribution.
You get a joint distribution.
Yeah, because if I have the only randomness is P of U.
But you have a joint distribution, not a like that's not a causal one.
Yeah, so far just follow the definitions.
Okay.
Nothing more. I'm trying to make it very minimal. That's how the potential outcome people like to expose it. So I want to go through that style, and then we'll go to the arrows and causal.
Okay.
Yes.
Please go over one more time what the last one.
The last two columns are, I only observe the treatment you treated the person with, but I don't know what would have been had you been given a placebo. But there is some effect that would have been had you been given a placebo. At least I can assume a variable for that. That's all. I don't know what it is, but I'm just assuming it. So in this particular case, I'll only observe, because its treatment equals 1, I observe only this number. I don't observe this number. Okay. So at least the randomness, so you can think of X also is a deterministic function of U because of the simple modification I did. I did a copy of what you observed also in the exogenous. It's just a, yeah.
So I think you got that cross from.
Thank you. No, the cross is 3.1. I got it right. Y0 is not good. Treatment is 1. This is Y1. This is Y0. I only observe Y1. So treatment is 1. Okay.
This is like a purely data analyst worldview. Yeah. I'm seeing this data and like
Yeah.
Okay.
So I have friends in potential outcomes, so I can't say that. It's as specific as it can get. Yes, we are used to graphs, tend to think of this differently. Graphs, people like to work with joint distributions and create whatever transfers they want, assume all sorts of conditions between them, and then do the analysis. That's style, and I go with it to see where we go. Right? Okay. So no, yes.
But not the outcome is not explicitly a function of the thing.
It is. So, oh, sorry, I should have been. Yeah. Sorry. So the outcome is a function of P. Right? Really sorry. The most important thing. Shouldn't have missed it. Yeah, it's a function of P. Correct. So this gives rise to two potential outcomes. So I call it POs. And I'll absorb the subscript into as a subscript. So I'll just write it as YT of X comma. Let me just put Y small t to say that both potential outcomes exist. Just don't know what one of them is. Yes.
It's a function of X and U, and it is deterministic. Why do we need T and Y?
The reason is that T is deterministic of two things, but one is missing, and there's a distribution over it. So P will have a distribution because I only observe X, Y, T, and Y. So there will be a distribution over everything.
Yeah, but Y need not depend on T, right? Because T is deterministic.
No, but the outcome will depend on the treatment, right?
Okay, that's actually.
Yeah, actually.
And one more question. Y0 and Y1, right? These functions are.
Actually, put superscript. But yes.
These functions also do. Y function do depend on individuals. It's specific to individuals.
Correct. This one is always under. But everybody has taken the. was given placebo. Let me just define what I want to estimate. Estimate the phase treatment effect.
Yeah, delay. But if P is a deterministic function, which, like, correct me if I'm wrong, means that you, based on X and U, P will either be 0 or it will either be 1.
Correct.
And so there's inbuilt randomness, that's fine. But now, if I'm giving you X and U, in Y, you don't have to explicitly put P. You can first compute P and then.
I mean, I have what is the potential outcome, and depending on the T I choose, one of them will be.
Okay.
That's what I wanted to say. So it's called. Okay, so let me do all this. So there's something called. Okay, let me finish 8 and then go to the randomization, and then I'll come to consistency. So the average treatment effect is nothing but the expected value over U of Y1 minus Y0 of U. Okay, I'm writing it as U. I know that it is a function of X and U, but as I said, U captures, I mean, you can take an identical copy of X and put it in U, and it doesn't create any problems. Okay, so I'll just call it U minus Y0. Right? The most important thing is that only a subset of them have Y1s. Only a subset of them have Y0s. But this formula, at least ipso facto, requires you to complete the matrix before estimation. So that's the main problem. Okay. So you are doing extrapolation. There's no interpolation here. Okay. So under what conditions you can reliably extrapolate and at least have a good estimator, consistent estimator. That's what we will actually try to do. Let me have one remark about T of X comma U. It also captures randomized experiments. Why? Because whatever randomization coin toss you have, you can put it in the exogenous variable. That's totally fine. And you don't have to depend on X at all. And that's called missing completely at random. That simply means that T is actually independent of Y0, Y1, and X, everything. This randomly tossing coin. Yes.
If I recall correctly, you had mentioned U tilde is U comma X. So this would be an expectation over U tilde.
Correct. But let's call U as U tilde. It's just that I'm creating a copy of whatever you observed and calling it also unobserved. Yeah, it doesn't make any difference at all. Right? Okay, now there is consistency. Consistency is.
Sorry, what happened to X in that? You fix X and then you ask this question. Is that what it is?
No. When I take expectation over U, because I defined U to be like X comma, I mean, I defined a new variable U tilde, which includes X. You can, in general, just think of this expectation as expectation over V. Exogenous contains all the variables. Subset of them you know, others you don't know. So it's a much cleaner way of.
What happens if we don't take the same support U, like we commit expectation only over?
No, but there is one support in the data. Right? I'm only asking about treatment effect, not on the new distribution. Only on the population you have observed.
Yeah, I'm saying, what if we do it without extrapolation? Like whatever we have Y1, we do it separately. Whatever.
Because okay, so coming to that. So that depends on missing, not at random. So if something is missing at random, life is good. Because anybody could have been in the control or in the placebo. So we have enough number of people, any region will have equal number of control and placebo. So life is good. But if the doctor starts looking at you and some exogenous variable and starts deciding the treatment, you can bias the treatment. An example is, again, the same kidney stone thing. I could prefer non-invasive treatments to you because your kidney stone was big, sorry, which was very small. Okay. But the moment your kidney stone becomes very huge, I go to a more conservative conventional treatment, which is the invasive treatment. Which means the type of people who are seeing one treatment are not the same as the type of people who are seeing a different kind of treatment. So ideally, for an average treatment effect estimation, you want to know people with small kidneys and big or the large kidney stones. Both of them, you want to know the difference. But if you only estimate in isolated populations, you cannot average them. Yeah, so we will make one more condition. So you can come.
So one might have asked for, there are two other MCAR conditions, randomness conditions one might have asked for, which is T is independent of U. That is possibility one.
No, T can never be independent of U because U is all those exogenous variables, including the random point toss you have in your randomness experiment. Okay, T is always dependent on U. Only question is whether T's variation depends on anything else that you observe or not.
And second, you could have asked for T is independent of just X and not Y0. I didn't catch what is T is independent.
Yeah, I mean, this is just a more general statement saying that the treatment choice does not affect my outcome. There are cases where can. Okay, I'm just assuming that that's not. That's completely okay. Consistency is the thing I told you. The y that I'm factually getting is nothing but t times y1 plus 1 minus t times y3. Okay. So if t was 1, I would put this guy. If t was 0, I would put that person. Right? That's it. That's all it means. Coming back to the question he asked, how can you estimate across different groups? So I'm going to use the third assumption, which is called causality. We will come to relaxing these assumptions, but we will assume that every person, like in the sense that every observed pre-treatment variable has a finite chance of going into either of the groups. Okay, so I have P of P given X greater than 0. I'll make one more assumption. Let's first understand what can happen when you know P of T given X, and then we worry about estimators for this and so on, right? So the treatment assignment propensity is non-zero for either of the two. You could have gone to both, control or placebo. So I'm biasing, but I'm not completely cutting off. So it's like somewhat closer to randomization, but it's a soft randomization. Okay, is that clear? Yes.
I didn't catch consistency.
Consistency simply says how these three rows are related. The factual y you observe is one of the potential outcomes depending on which treatment choice you make. There are two counterfactuals, there are two, that's all, there's nothing else. But it's very important. Okay, so I actually stated the fourth condition, and I guess I have to move to the next lecture to actually derive the first set of estimators.
Just again, like just to be somewhat basic here. So till now, it's what we have is two family of random variables and three deterministic functions. That's right. And your
Forget about even two. There's only one.
One family of random variables, three deterministic functions, and your objective. The point is that you're given a partially filled table, and you want to compute that.
That's it. That's the name. Yes.
If T is independent of X, it doesn't make sense, right?
No, right? I can still have probability of P is independent of X. It's just P of T, but it simply means that P of T is greater than 0, which means that there's non-zero probability for either of the choices. So it's not 0.
So these three are like independent conditions. You can assume that.
Yeah.
Okay.
I'm saying this doesn't obviate anything about whether T depends on X or not. It just simply means for whatever X, if there is a conditional probability, that has to be greater than 0. You can say that the conditional probability doesn't care about X, that's fine. But just the probability has to be greater than 0. That's all.
Can you explain the first MCAR condition?
MCAR condition simply means randomization. For our category.
So T is independent of these three random variables?
Yes. Everything is a function of U. Think about it that way. Some of them are hidden. That's the best way to think. In physics, all that is not known causes what is known, and everything is deterministic. There's nothing random, right? So T of U, Y1 of U, Y0 of U, and X of U. That's it. Yes.
Yeah. At the end of the day, all we're basically doing is solving a bunch of treatments on different people, and we just want to find out, okay, what could have happened if I performed a different treatment?
Yeah,
that's all.
That's all. Yes. Okay, so let me actually tell you another condition. It's very important. without which you can't do estimation, or at least.
So, consistency just means the condition that y equals y1 plus 1 minus ty.
Small t.
Yeah, t is a random variable here.
Whether you take the treatment or not.
Yeah.
So, but like in the table t, let's say t equals to 1 means you give the treatment,
y1.
right?
Yeah.
So, and the outcome you get is y1.
Yes. You will get that. So t is equal to 1, this is 0. 1 yeah, just calling it consistency. Just generative mode. Okay. So now let me give you the most important condition. Since it's most important, let me erase this. Okay.
So in principle, yeah, T is the final output, and like you are doing, whether U is happening or not, you are still doing it, like in the sure thing principle. So,
I'm just giving you a generative model for all that I said about the data. There is some exogenous randomness. Everything is a function of that. Then T is one of the functions.
sorry, and X not there, not U. So you're saying T is independent of X. In the sure thing principle, you're saying, okay, if X happens, you still do some action. If it does not happen, you still do action. In that case, this particular action T is independent of X.
Correct.
But there is some U that you don't know for which things are not.
There could be very complicated dependency to become to that. So the other one is the most important assumption. I think the fourth assumption, I think, is what is called conditional ignorability. See, there are various names for it: conditional exchangeability, ignorability, and all that. I'm just adopting one, but the condition is more important. So it simply says, okay, this is a very difficult condition to digest. So it's a good time to stop actually. So let me do it. So y1 of u, y0 u is independent of the treatment condition on x. Okay. It says what could have been in both cases is independent of the treatment choice given I have observed x. Okay, that's all it means. It's what exactly it means. There is a joint probability distribution induced by P of u because everything is a deterministic function of u, so there's a joint distribution. Now, all I'm saying is that the potential outcomes are independent of the treatment choice given x. Okay, just to give a quick example, suppose this gene was unobserved. This was part of u. Let's say I force you to smoke. The human body, suppose what Reynolds Fisher says is true. Let's say there's also a forward arrow. This condition is not satisfied. Why? Why? Because smoking depends on the gene, but the potential outcome also depends on the gene. For either case, whether you smoked or not, the potential outcome is already in a different world, but it involves the same u variables because u variables are not getting. They're all pre-treated. So they are not going to get affected. The only thing you can affect is y. That's all you can affect, right? So the point is the treatment assignment in the factual world should not depend on a factor that causes that actually affects the outcome which you don't observe. Very simplest example is this example. You don't observe the gene, but the gene actually causes you to smoke. And the same cause is responsible for both potential outcomes. I mean, whether you smoked or not, there's going to be an effect. This conditional distribution, there's going to be an effect. Okay? That effect, it still depends on you. But the same you also caused your treatment, basically, the treatment choice. In randomization, this won't happen. This is one of the main reasons why you want randomization.
But can you place X, U, and T in that picture?
Yes. So T is smoking. There's no X. Okay. This is the potential outcome, which is you live or die. So this is outcome of you live or die under smoking.
Lung cancer and
Yeah, or lung cancer or lung cancer. And here you want lung cancer or no lung cancer when you have no smoking. It so happens that there's a factor that determines in either of the world, the outcome is actually determined by something that actually caused you to smoke also, right, in the data set. Okay. So in some sense, there's some unobserved link between both. It's the simplest case where this is true, but this is the more general condition. Okay, yeah.
But lung cancer, given smoking, is independent of whether you smoke or not.
No, there's no given. This is condition. This is a potential outcome.
Yeah.
I force you to smoke, and you had an outcome. I force you. You come. You born again. You come to me again. I force you not to smoke, and then you have an outcome. Those are the two things. I'm saying those two should not depend on the factor that actually made me decide the treatment. Okay, so I think I should draw the graph. Right? So there are two words here. This is called the factual world. Now you see why graphs is important. So you have X, you have T, there is a U, right? And there is Y. That's the picture. Okay. Now, what is Y1? How do you produce Y1? You intervene here. T is equal to force to 1, for example. This produces Y1, right? And this still exists. Common randomness. So potentially, so there is also a copy of Y0 when the same thing happens and T is equal to 0. I'm saying these two variables depend on something, and that something should not have decided your treatment in the factual.
That is not satisfying conditional ignorance.
This is not satisfying conditional ignorance. Because the gene causes the outcome in both cases, right? I mean, depending on the smoke, of course, smoking has an effect, but it is a function of the gene. But the same thing is what is Fisher's claim was that it has a higher propensity for you to smoke. So this condition is not that.
So X is effectively a gene.
There's no X here. X is null, I said. There's no features.
So what are you ignoring?
No. Okay. Conditional ignorability simply means that you can ignore or not ignore the unobserved variables. Here, you can't ignore the unobserved variables. Here, you can ignore them and still do my math. Is it clear?
And the gene would, I think, falls in X or U.
Gene is U. Okay, I should have said. Gene is a part of U. Unobserved. I don't know which gene it is.
When you say should not hold a meaning,
Oh, sorry.
when you say this should not hold.
No, I said this should hold.
Should hold for what?
For estimation, 8 estimation. For you to be able to complete this.
We are essentially trying to find out the relationship between the treatment and the outcome.
Yes.
We cannot do that if this does not.
No, you cannot find out these missing entries and then subtract to tell me the counterpart.
So you need to have these 4 conditions for you to be able to perform.
Yeah, I'm not saying necessity, sufficient.
Yeah.
We'll come to necessity later.
But if you have these 4 conditions, then ATE can be computed.
Computed, and I'll tell you how to. It's very simple, it's regression. But I will tell you how to. Yes.
And so Fisher's thing, you cannot do it. So lawyer can't refute Fisher because condition 4 is not set.
But you can refute Fisher. Let's try the third lecture.
Okay.
Yeah.
It's both the condition.
Correct. That's exactly what Pearl says. So you are agreeing with Pearl, but I don't want to make any statements. It's being recorded. Yes. This is one condition. Yeah. Basically, X satisfies backdoor criterion. If you are familiar with Pearlian.
In the beginning, you said Fisher's this argument could not be refuted.
With this, just with this. This doesn't hold, so whatever I'm going to say is not going to refute this argument. Maybe there's some other special condition which can refute.
Just for my sort of basic understanding, what you have is a generative framework, which is X, U, which gives you X, and 2 deterministic functions.
Everything is random. Only use random.
Yeah. T and Y.
Yeah.
Now the point is you're given this partially complete table.
There are two Y's.
Yeah.
Compared to two words.
Two words.
But the fractional word sort of mixes them.
Yeah. Okay. And if you have these four conditions, including conditional ignorability, you will be able to compute
it. So the whole causal inference business is assumptions leading to identifiability under confounding. That's all the whole business is about. The only question is, what is the set of conditions you assume, and what can you show that people have not previously done? So from a research angle, that's one interesting question. Still being worked upon, very active.
So there's a missing assumption like is binary or something or
No. So yeah, the good part about this thing, the whole thing, I mean, somewhat we'll get into maybe parametric stuff, but mostly a lot of what I say is completely non-parametric. We are only worrying about whether there exists an estimator at all in this case or not, which means there is a violation of the sure thing principle, which means there are two answers to the same thing. You have not told me fully, and I cannot justify. There is two causal models I can come up with which can satisfy all your criteria, and you can have two different data sets. If that happens, there's no unique identifiability. So it's really about uniqueness. And this is non-parametric. There's nowhere I have assumed anything parametric. Okay, T I have assumed to be binary, but you can extend the same thing with heterogeneous. It's very easy to work with binary, so I just have.
So in the second graph,
Yes.
both is satisfied with particular proportion.
Support for what? No, I'm just saying this is the graph. Whether it is satisfied or not is something you have to check. Who knows, right?
Or the second graph also, where there's no connection between T and.
No, there is a connection between y1 and u, y0 and u. The same u affects t, but the u has so many randomness.
Yeah.
So you have to test whether they are independent or not.
If U was not connected to T, like if that was the actual graph.
Correct. If you ever, okay, good. That actually relates to a question he asked, which is if you always made your treatment determination based on only X and some independent randomness, like some coin toss or something like that, then this condition is true. So if your doctor looked at only your medical report X, right, whatever the features corresponded only to that and made a decision, but with some randomization, then life is good. That's correct. Then this condition will hold. But what if the treatment was decided based on some unobserved thing which you didn't record, for example? Then you run into trouble.
So this gives you conditions under which you can ignore variables that are not in your table.
Right. You. So and then tomorrow, I mean, I think the next lecture I'll go to all the estimators. There's just different ways of massaging the same estimator, writing in different ways. Each has some different kinds of variance profile. So I'll quickly go through the estimators. Not very important for me to derive finite sample results because that's not the main focus of this lecture series. It's more about trying to find out when you can identify something. Most of the yeah.
So you're asking for y1, which might be a counterfactual never observed to be independent. So what does that mean?
Correct. That's what Pearl says. What does it mean? So you should have an alternate approach. Okay. This is what is assumed, this is what it means, nothing more, nothing less. But you can have an alternate generative model where you can try to say when these things can happen or not happen. That you can do. Okay. Using graphs and Bayesian networks and all that, which is the approach of Pearl. But there's nothing more to say other than.
So if you have a generative model which gives you y1 of 0 and y0 of u and y1 of u, then you can make claims.
Correct. And then but you can make claims if you know some causal knowledge. For example, this guy, I just told, see, here nobody gave me any y1 of u or y0 of u, right? I didn't even know any distribution. I just knew the graph. If I knew the graph is of this form, I know that that is violated. So let me give a different graph where it's not violated. Maybe I should have mentioned this first. Right. Let's consider, this is called the famous M-biased example. You can go and read about it. There's a lot of controversy around this example, but anyway, so there is some observed variable, we call it X. There is U1, there is U2. Whenever I say U, it's unobserved. Okay, so I can't draw the dot like this. So, this is treatment. This is outcome. This is one of the few cases where treatment is actually based on something you don't observe, but still conditional ignorability is true. Okay. Very simple. most people, so this is the only observed thing, right? This is all unobserved. So when somebody gives you a new feature, all machine learning people will use that feature. But if you do that, you will create what is called collider bias. So if you condition on X, this is not true anymore because you can talk like this. So the same views affect Y that affect T. But if you choose to ignore X, for example, in this case, for X is null, this condition is true. It's a very non-trivial example where treatment is actually dependent on something unobserved. But still, this condition is true for a chosen X. But it doesn't, I have to ignore whatever you gave me, so I have to just consider it to be null. So this is a non-trivial case where Simpson's paradox creates some issues. Because this is the exact question I asked you. So if I add gender, then the thing reverses. If I add something more, it again becomes positive. Which subset is the correct one? So here is one case where you have to ignore what is given to you. And the estimate is very simple in this case. It's just probability of Y given T is equal to 1 minus probability of Y given T is equal. That's it. Just ignore everything and just create the conditional probability, and that will give you the average effect. And it's a non-trivial case because treatment is actually dependent on something you don't observe, but still this can be shown to be true. See, all these things start appearing to you only if you start doing sparse Bayesian networks. Since I've not introduced that to you, if ipso facto, if you ask me when this will hold, I mean, I can just say simply this, the condition is what it is. Yes.
Are the first three conditions sufficient to compute your average effect? There should be a way to compute the joint distribution between Y1 and Y0.
But then you need to tell me P of U, right? First of all, you need to tell me Y0 of X comma U. I only have the factual.
So what are you trying to estimate with this difference?
On the same population, if I treated everybody with T equals 1 and treated everybody with T equals 0 and subtracted them, what's the average?
Are you looking at probability Y equals 1 or what are you looking at?
Okay, so I'm looking at Y1 of U minus Y0 of U expected value. What I'm looking. But I only have Y, but I am saying this is equal to this in this case. Not proven yet, but we'll come to it. Yes.
Okay, but there are gaps like you said. So if you don't know Y0 and Y1, how will you compute?
Yeah, we will see in the next lecture. These conditions will enable you to compute. That's our thing. Actually, it's a very simple exercise with whatever I've given you. All you need to do is Tower property of expectation, and you will get the answer. It's very simple. You can do the exercise if you are interested. But next lecture we'll begin with it.
The difference is the one that you mentioned in the.
Yeah. So I didn't even get to that. It's just mostly the thing. For today's lecture, I just did the sure thing principle plus the main like definitions which you can get in Hernan's. But Hernan's book is written in a way.
The recording.
Yeah, so snacks will be available outside for all of you. And let's thank the speaker for the first lecture. I'd like to request Professor Siddharth to give a small token of appreciation to the speaker.
Questions don't count.
Thanks.